Hi, my name is Dr. Lucas Carr. I'm an associate professor in the Department of Health and Human Physiology, and I am the director of the Behavioral Medicine Laboratory within our department. I wanted to take a minute to talk to you about some of the research that we do in our lab. The mission of our research is to test and identify different solutions that help people become more physically active and reduce their sedentary behavior. Um, an example of one of the main studies that we run is something called exercise as medicine. The goal of this study is to test the feasibility, acceptability, and efficacy of an intervention. And the interesting thing about this study is that it's completely student delivered. It's overseen by faculty like myself, but is delivered by students who work as health coaches. And so it's a nice combination of research and student experiential learning. And the ultimate goal is to provide this service to members of our community who are in need, and we test whether it's effective. One of the ways that we test that is to determine if the program actually increases physical activity among participants who are in that study. Um, so here's a picture of some of our student health coaches from a past semester. Those students are enrolled in a class called Practicum in Health Coaching, and that class is delivered by the course director, Dr. Allison Reichter, and also Professor Aaron Litton is another instructor for that class. As part of our intervention, we provide participants regular access to one of our student health coaches. They meet with the coach every week for 10 weeks. They receive a Fitbit activity monitor to help set goals and self-monitor their behavior. And then we use some different types of technologies to communicate with participants as part of that study. On the other side of this study, so while we have students who deliver the intervention, we also have students who help evaluate the intervention. So we have research assistants. These are undergrad and graduate students in our department who are looking for experience. Shelley's an example of one of our wonderful research assistants. She's been a part of our study for the last couple of semesters. These students help collect data, help recruit participants, enroll participants, and really get to see the other side of an intervention from kind of behind the curtain. This is a screenshot just kind of showing some of the type of data that we collect in this study. Our physical activity is our primary outcome, and so we use little monitors called active pals that people wear on their leg, and we are able to track their daily steps, the time they spend sitting and standing and walking throughout the day. So we get a really good comprehensive assessment of their physical activity profile. Another study that I'm involved in is something called AYA Active, and this is just a different application of our approaches. So we deliver a similar type of physical activity intervention, but the recipients of that intervention are adolescent and young adult cancer survivors. There's lots of different populations that benefit from physical activity, and so my interests are in identifying those groups that are most in need and looking for help, and providing them the resources that would help them live a more active and healthy lifestyle. If you're interested in any of this kind of research, I encourage you to reach out to us. Our contact information is here. We're located in the field house. Feel free to shoot us an email or give us a phone call. Thanks.